At the International Day of our Congress, we had a very distinguished guest by our side, Professor Massimo Federico. Welcome, sir. He is the past president of Italian Lymphoma Foundation. I hope I'm right?
Yes, you're right.
And I want to talk about the lecture you have given today. There was a joint session between European Association of Hematology and Turkish Society of Hematology. Can you give brief information about this?
So today I talk about the management of patients with Hodgkin lymphoma that did not respond to initial therapy and necessitate of salvage therapy. So I will try to just summarize how was the situation 30 years ago, 20 years ago, 10 years ago, and now the opportunities we have with new strategies, with more appropriate strategies, new drugs, new compounds. And of course, most of the new achievement in this field depends on the availability of new compounds, monoclonal antibodies targeted against the CD30 receptor on the surface of Hodgkin lymphoma cells, and also the checkpoint inhibitors, and new classes of drugs that can contribute to better treat the patients and achieve satisfactory results also in this setting of patients that in the past were offered only high-dose therapy and autologous stem cell transplant, and now have these opportunities also if they recur after transplant. So now patients that recur after transplant have more chances to be treated successfully and achieve a long-lasting remission also after different lines of therapy. So there are good opportunities for the patients today compared to the past.
And I want to ask you about the international collaborations. Today there was a joint meeting between European Association of Hematology and Turkish Society of Hematology. How does these meetings affect the researchers, the projects?
So starting a few years ago, the European Hematology Association started in cooperating with different national hematology association, including the Turkish Hematology Society. And so through this cooperation, we believe that it will be possible to improve the quality of clinical research, the quality of care of our patients whenever they live. And as an example of this cooperation, at least for my field, the lymphoma research, we started a couple of years ago in cooperating with several Turkish centers in the T-cell project. The T-cell project is an international prospective registry for patients with T-cell lymphoma. We collect information. The plan is to collect information on 1,000 cases diagnosed all over the world. We have almost 400 patients already collected in 1 year period, and some of them come from Turkey, and the other comes from Australia, Korea, North and South America, and Europe and other countries in Europe. So this is really an example on how friendship could also promote cooperation on the scientific point of view, and this probably will translate in better care for our patients.
Yeah. And our participants will be watching this interview. So do you have a message to our participants in Turkey?
So probably I would like to wish to my friends in Turkey to continue in believing in the international cooperation, not limit their interest in discussing inside the borders of Turkey, but continue to explore the huge opportunities we have if we continue it, if we expand our cooperation. So we live in a global market, we live in a global world. So if something good happens in France, we have to translate as soon as possible in Turkey. If something good happens here, we have to transfer elsewhere, because we should try to offer the best of care to all the patients that need to be cured with the most effective and available treatment strategies.
Thank you so much
Oh,
being with us here in our broadcast.